Here's my interpretation of what the heart looks like. It's not exactly the same, but it's good so we can learn all the terminologies and how to use the correct terms when we are referring to a specific part of the heart. So we'll start by labeling every single part and what we need to know for later. So the heart has two atria. And when you refer to only one of them, then it would be an atrium. So here would be the left atrium. And this one would be the right atrium. So since the heart has 4 chambers, 1, 2, 3, 4, the bottom 2 chambers are called the ventricles. So this one would be the left ventricle, and this one would be the right ventricle. What divides the heart into right and left is this muscle, and this muscle runs down this way and towards the right side of the left side of the heart and towards the right side of the heart. This division right here that makes a division between left and right is called the septum. And also we can notice that the right side of the heart, the muscle is really thin, but then the left side is a little thicker. And this is because the blood that's on this side is being pushed towards the body, so it needs a lot more pressure and the muscle works a little harder, so that's why it's a little thicker. Let's see what else. This tube, very big, large vein right here behind the heart is called the vena cava. So this whole thing is the vena cava, but we can refer to as inferior vena cava, and then superior vena cava. I'm going to put VC, but we know how to spell from here, vena cava. And why do we say there's an inferior and a superior vena cava? Part of it, not that there's two, it's just a way of referring, as if you were referring for your hand. Instead of saying hand, you would say lower part of my arm, and the upper part of my arm would be close to my shoulder. That's all that is. And the blood that comes up towards the heart here is from our extremities and our abdominal cavity, thoracic cavity, and then this upper part right here would be from the lungs and the brain that would come in and go to the lungs to be oxygenated, but we'll get there later. This part right here, it's called the pulmonary trunk, this part, but then it divides into right and left pulmonary arteries. So we'll call them, this whole part right here, just pulmonary artery. And this is where, artery with an Y, sorry, and this is where the blood goes to the lungs to be recycled. And then we have this big red coronary artery right here, and we'll call this one as aorta. And the aorta is what receives oxygenated blood and sends to the body. And then we have these 2 little veins right here, and they're called pulmonary veins. Pulmonary veins because they receive oxygenated blood after this blood from this side goes to the lungs and come back to the heart. And I will explain that in more details. It's just so you know why they're called what they're called. What else are we missing? We have the left ventricle and the right ventricle. What is this right here? Those little fibers and tubes. They're called chordae tendineae. And these little tubes, tendons, they are used to hold valves of the heart. So let's see. Here's one valve. Here's another. We have 4 of them. Here is another. And the last one right here. Well, there's 2 valves right here. They are between an atrium and a ventricle. So they're called atrioventricular valve. Atrioventricular. And I'll spell them down here to make sure that we know how to spell it. Atrioventricular valve. Okay? But the right one, it's called a tricuspid valve. So let's label that. Tricuspid valve. And I'll show you in a minute from the picture on your book why is it called tricuspid. And this one is called a bicuspid. Sorry. This one right here. It's called a bicuspid valve. Okay, so let's get a picture from the book and take a look at it. So this is the right side of the heart. Bicuspid, because bi means 2. So do you see how it has 2 little sections of tissue that's folding in? And here there's 3. So this would be the left atrioventricular valve, and this would be the right atrioventricular valve. And so this 2 now on the middle. Let's see what they are. Since this is the pulmonary artery, then this one would be the pulmonary valve. And since this is the aorta as we labeled up there, this would be the aortic valve. So now that we know all those terms, we can outline them. But before outlining them, let me just mention something. We learned that these tendons right here were called the chordae tendineae. But what are they for? They are to anchor this valve down so it doesn't flap, like we'll flip it over the other way. Because during blood flow, the blood comes in through here to this ventricle, and it cannot go back that way. So when blood rushes through, it seals because of its position. The chordae tendineae anchors it down so the blood cannot flow back that way. Okay, so now let's go ahead and outline what we have learned. So the heart has 4 chambers, and they are 2 atria, because it's plural. If it was singular, it would be right and left. Atrium. We have 2 ventricles. And then it would be right and left ventricles. What else can we say? We have a vena cava. We have a pulmonary artery. We also have an aorta. and a pulmonary vein. And the reason why I separate this two is because we can say that this two structures, the vena cava and the pulmonary vein, carries deoxygenated blood. And these two structures carry oxygenated blood. Okay, so now we can talk about the valves that we have learned. There are 4 valves, right? We have 2 atrioventricular valves, one pulmonary valve, and one aortic valve. So the atrioventricular valve, there are 2 of them, right? One of them is the tricuspid valve and the bicuspid valve. And why is it called atrioventricular valve? Is because it's between this this valve right there is between the atrium and the ventricle. So now the pulmonary valve is the valve between the ventricle, the right ventricle to be more specific, and this is both for right and left atrium and ventricles. Both of those valves are called atrioventricular. I'll put it right here, the right one being the tricuspid and the left one being the bicuspid. Now the pulmonary valve is a valve that's only for the right side of the heart between the ventricle and the pulmonary artery. And then the aortic valve is a valve that's only for the left side of the heart, and it's between what? The left ventricle and the aorta. What other terms have we learned? What separates the heart right and left side? So what separates it would be the septum. It separates the heart into right and left. And what else have we learned? We have pulmonary, well, we already talked about pulmonary veins up here. Let me think, what else are we missing? Oh, we're missing the chordae tendineae. And the chordae tendineae, I'm going to put them right here. Chordae tendineae is the tendon, the ligaments that holds the bottom of the tricuspid and bicuspid valves to the very floor of the ventricle, so they don't flip inside out and the blood cannot go back. Since it's a closed system, it's a one-way system.